Socio-ecological factors that influence readmission with dual diagnosed patients. Background information. Research has proven that dual diagnosis is often overlooked when identifying socio-environmental factors among the mentally ill in communities. Dually diagnosed patients pose a particular challenge to psychiatric treatment since they tend to have more of a chronic course of illness, higher rates of relapse and rehospitalization, lower rates of treatment completion, and more complicated service needs than those with substance use problems only. This is cited from Strahler, 2009. So the type of study for this research is a qualitative descriptive study. And the overarching research question is, what social ecological factors influence readmission among dual diagnosis patients in an acute inpatient unit? The participant population and sample size. So the adults that are usually admitted on the inpatient unit range from 18 to 70 years old. The data sampled is 15 patient demographic data. From recidivism reports that are reported per CMHC, which is Community Mental Health Center in Lawrenceburg, Indiana. And this ranges between 30 to 90 days of readmission rates. So who's affected? When looking at who is affected by the social ecological factors that contribute to barriers to continuum of mental health care, clients who struggle with severe mental illnesses and those living with dual diagnosis is most affected by this problem. Patients' families are also affected by these issues, as well as learning how to help their loved ones receive treatment. So the purpose of this study is to identify social ecological factors of readmission rates and also help identify what those social ecological factors are and bring awareness to the influence that those factors have on the treatment of mental health and dual diagnosed patients. The implications to social work. So as social workers, we follow Code of Ethics. It's the National Association of Social Work. So one of the ethics that is important to this research among the population that is served on the unit is patients' right to self-determination. And this also correlates with recovery-oriented care, which will be talked about later on in this video. Social workers are also advocates, so it's important to have the tools necessary to help patients succeed when they go to leave the unit, as their stay here is between 1 to 7 days and often longer if they're experiencing homelessness or some kind of barrier. Data collection procedures. So the data collected began in January 2022 and ended March 2022 with the permission from my supervisor. The data collected will be patient demographics as reiterated before. It is randomly selected from recidivism data dated from November 2021 to February 2022. Readmissions for each month can range from 4 to 10 patients. So the results for this study, as you can see here, this is a table of the demographics that was collected from the data of the marital status. There's 4 married and 11 single. And on the next slide, we will see the graphs of what that looks like for the rest of the demographics. So here we have patient education. So of the 15, 7 of them were high school graduates, GED, or even a higher education. And then of the 8, it was none, so meaning that they did not or were not able to graduate high school. The primary diagnosis here. So as we can see here, schizophrenia and other schizophrenic disorders had a major impact on the 15 patients. And as you can see here, the color-coded of the other diagnoses, and the dual diagnosis here, it says 7, but it does not add to the rest of these numbers, considering we only have 15 patients, but of the 7 patients out of all the other disorders, there is a substance use disorder along with that. The housing type here, there is independent living residential housing, which can be through CMHC housing. There is homelessness, and then there's also supportive living for those living with disabilities. And as we can see here, homelessness is a prominent factor in the demographics. And then race and ethnicity, the primary population for the 15 patients were white. So for the discussion, there are outcomes to analyzing the demographics of the 15 patients that stood out the most. Homelessness, as we reiterated before, and the schizophrenia disorder. So based on the literature, socio-ecological factors need to be studied more and factored into what readmission rates look like and what influences that. Recovery-oriented care and mobile crisis success. So the ability to contract for safety through mobile crisis is really important, and it is actually reported that psychiatric crisis services contributed to the reductions in the number of inpatient admissions and readmissions. And this is cited by Kim S. and Kim K. 2017. Mobile crisis teams usually respond to emergent phone calls for crisis intervention, offer support services, house calls, referrals to case management for continuity of care. And then recovery-oriented care has proven to be effective on the IPU as it focuses more on the patient rather than the mental illness. Coping skills, goal setting, and treatment, and using a recovery-oriented approach is used when working with patients on the unit. And this is also cited by Koval 2016. And this evidence correlates with the community mental health centers policy and guidelines to how they treat their patients on the unit. So in conclusion, and here are the limitations for my research. There was a short time frame for the research as it was only a few months. The inability to rebuild rapport with patients due to short stays on the IPU, because they are really meant to be there for stabilization and treatment planning and not there for much longer. One of the only options for the type of study was the description study due to ethical dilemmas and the lack of diversity in results. So as reiterated before, the population that was collected is primarily a white population. And that concludes my study. These are my references for the voiceover and/or written. Thank you for listening.